Because we have someone that's joining us from Capitol Hill, Congressman Buddy Carter of Georgia. Congressman, thank you for joining us.
Thank you.
Absolutely. Well, you're the only pharmacist that serves in Congress in the U.S. House. So you bring a very interesting perspective to the table here. As a health care provider, do you think that the proposed emergency funding bill that has been talked about at this point, do you think it's sufficient to address the coronavirus outbreak as it stands?
Well, let's don't get caught up in numbers now. What is sufficient is that we be prepared. I mean, people think, oh, the higher the number, the more proportional that we're going to be prepared. That is not the case. We want the right number, but if they need more money, all they've got to do is to come and ask for more. We will make sure it gets there. We'll make sure that they have all the resources that they need. But let me say this. Listen, in my years of practice as a pharmacist, I have seen nothing short of miracles come about through research and development that has happened through the pharmaceutical manufacturers. I thought the meeting that was just finished at the White House was a great meeting. Everyone's singing from the same song sheet now. We've got the private sector and the public sector working together. We as citizens need to do our part. We need to wash our hands. We need to make sure we are keeping healthy. We need to make sure if we got a cold that we're not spreading it. Don't go visit anyone in the nursing home if you got a cold. Stay away from places like that. That's the kind of thing that we need to do. Now is not the time to panic. Now is the time to be prepared.
All good common sense. I want to get Gary in here on our panel.
Yeah. Congressman, the good news that I keep reading about, and it's on the Johns Hopkins website, is 45,000 people have actually recovered from this virus. What do you attribute that to? Is that just a matter of course running its course? Any type of medicines that maybe not cure it but help through it?
Well, certainly it's hard to say at this point what exactly is causing this. I suspect as the numbers increase, and they will increase, that the percent of people who are severely impacted by this, who die by this, will probably decrease because what we have now is a finite group in China. That's not the best test group for us to have. I mean, you're going to have a high percentage of people who don't have access to health care like we do in America. They're going to have a higher rate of severe results as a result of this illness. So as it spreads throughout, we're going to be able to treat it better. We're better prepared. We have a better healthcare system. There's no better healthcare system than in the United States of America.
Congressman, thanks for joining us this evening. There's been a lot of concern about the amount of medications, pharmaceuticals, particularly generics, that come from China and India. Is the reliance on Chinese medications going to be a problem in treating the coronavirus, do you think?
That is certainly a concern that I have expressed during our member meetings. I expressed it to Dr. Hahn with the FDA. He has assured us that the FDA is going to do everything they can to notify pharmacies and wholesalers who provide medications of shortages so that we can make sure that we're stocking up on equivalent medications, similar medications, and making sure that no one goes without. It does bring to light a serious problem, and that is our reliance on China in particular for our generic drugs.
Congressman, it sounds like you're very optimistic right now. What else would you tell the American public to try to make sure that everyone is calm and doing their part? You mentioned hand washing and things of that nature, but we've heard about people, making a rush on masks. Is there anything else that you can give the American public right now to calm the concerns and make sure we're all doing our part?
Well, particularly those who have a cold. Those are the ones who should be wearing a mask. If you've got a cold, wear a mask, because that's the way that this is spread to other people through droplets. So you're the one who should be wearing the mask if you've got a cold. And if you got a cold, try to stay out of public places. Certainly try to stay out of nursing homes. And it's okay if you have to miss a day at work. You don't want to spread this. If you cough into your arm where you're not spreading it around. Just common sense things like that, as I mentioned before, washing your hands, all of those things are so vitally important.
Thank you so much, Congressman. We appreciate you being with us.
Thank you.
Countdown.